It told me that patient satisfaction was skyrocketing. More and more physicians wanted to work in that room because for them it meant less stress, less burnout.
My question is, and I guess, I would like it to be for the US healthcare system, but the healthcare in general, if there is one method, and I know that doesn't feel good, but if there is one method that you could introduce or think is most vitally important to get the biggest catalyst in healthcare when it comes to AI and technology, what do you think that method is?
It wouldn't be a futures method. It would be a concept. And the concept is called patient design, which we published a paper about that, which we mean by that is that you involve patients on the highest level of decision-making. So if it's a healthcare government, it's the minister level. If it's an organization like the WHO, it's the director level. If it's a company, it's the CEO level. But on that highest level, you have to proactively involve patients. And the US Food and Drug Administration has a patient advisory board for exactly that purpose. Because for me, just the idea that we people, working in and working for healthcare, organizing and designing processes and guidelines and technologies and products and services, how can we think that we can come up with anything useful, meeting real-life patient needs without actively involve patients on the highest level of that decision-making process? That's what baffles me. And throughout my whole career, the futures methods and including those futures methods into the way policy makers and decision makers design healthcare, that's about the last 2 years. But throughout the first 1.5 decades, my whole scientific career has been about searching for proofs on and making observations and publishing analysis about why patients have been the most underused resources of healthcare, not centuries, for millennia. Why the ivory tower of medicine didn't even allow them to contribute to the table. And the whole digital health revolution in the beginning of the 21st century with the sensor revolution, the wearables, the smartwatches, the AI-based services, at-home lab tests, and all these, what these introduce as a change, as a paradigm shift in the healthcare system is that patients can now contribute with their insights, their data, their opinions, their second opinions, their peer support, everything they can bring to the table. And this is simply an unprecedented cultural paradigm shift. That's why we always say that digital health is primarily a cultural shift, but a technological one, even though we always talk about advanced technologies when it comes to, the recent changes in the way we deliver healthcare. But as it's a cultural shift, we have to help the stakeholders understand how they can build relationships while using remote care services, how they can have a real-life conversation with a primary care physician and a patient while an AI scribe is transforming that discussion into a medical record that the physician can check at the very end of the meeting. These are the changes that truly matter instead of pinpointing a wearable sensor or an AI-based algorithm out there. And helping the stakeholders understand that there's a cultural revolution going on in which we have to provide you with all the help that you need to learn to use these technologies, to learn to build relationships while using these technologies. That's what really matters to me. And that's why I think patient design is the concept. If that I would have like a magic wand, I would install that concept or mindset everywhere around the world into healthcare governments, into healthcare companies, regulators, decision makers. Because if that concept is in place, we can make sure that whatever technology or product or service we come with, it will meet a real life patient need.
I want to be optimistic, Bertalan, about that, how I can't even tell you how to begin to make that happen, unfortunately. And I think part of it is always this juxtaposition of, ROI, like immediate, versus ideality. Like it's like ROI ideality. And I don't think people disagree on their ideals, but you have to, you have to make money, or you have to exist to be able to get there, is a kind of rock kicking down the road. But that's a different podcast in psychology, I'm sure.
No. If you don't mind, just let's spend 3 minutes on this, because I don't want to persuade you to be optimistic, because I think you're optimistic enough. But I want to point out that we have gone through such a quick evolution just in the last 10 years about digital health that we should give technology a minute, to be deployed. But ROI is an important thing. And when we published about patient design, I got invited by a Dutch hospital in Nijmegen, a beautiful Dutch city, to show me what it looks like when they actually implement patient design. And what they did was they wanted to open up a new part of the facility, like a new wing. And before having the final design, they invited their chronic patients to have their voices heard. And in the final rooms, we can find like round tables instead of the traditional work desks that patients hated, because they were excluded from the discussion, from the whole process. But with the round tables, they could look at the same interface, look at data, and have a real life, discussion with eye-to-eye contact. And they also asked for a designated space in the same room with the blue duct tape. They showed that was the place, the bed, where a physician could examine a patient. And then I asked about the ROI, because I'm coming from, Eastern Europe, and we always talk about not having enough financials to implement innovations. It told me that patient satisfaction was skyrocketing. More and more physicians wanted to work in that room, because for them it meant less stress, less burnout, easier to work with such empowered patients who were confident enough to comply with the therapy. And at the end, it was an IKEA table and blue duct tape on the floor. That was the cost of implementing patient design. So ROI must be on the table, but in fact, patient design is more about an openness or flexibility, about mindset, rather than spending millions of dollars in introducing tiny changes to the design of hospitals, for example, that would lead to such incremental changes.